let's get started. Again, my name is Andrew Cluley. I'm the Director of Communications for the Ann Arbor Public Schools. And we've got a couple of guests here that I'm going to let introduce themselves. We'll start with you, Dr. Swift.
Well, good evening, Janice Swift, Superintendent of Schools. Welcome.
Hi, I'm Jenna Bacalor. I'm the Executive Director of the Community Division and Student and School Health. It's great to have you all here tonight.
And good evening. I'm Keely Hoffman, and I'm one of the school nurses in Ann Arbor Public Schools. I'm also the lead nurse and the lead COVID nurse. So welcome.
So we're going to have a brief presentation, and then we'll get to questions from you and the community.
Well, good evening, and thank you for joining us this evening. I think, Mr. Cluley, this video will be posted, and we'll talk more about that later, but we appreciate those of you who are here, and we also appreciate everyone who will be watching this later. It'll be available on demand for all of our staff and parents and community members. It is an exciting time as we prepare to open the 22-23 school year. We opened with our school teams today. So it's been a very exciting day to see the schools really come to life with our teachers preparing their classrooms. And of course, all of our compasses are set on due north of welcoming our students in only a few days for the 22-23 school year. It's hard to realize, but this is the fourth school year that will be impacted by the COVID pandemic. We say that just to reflect for a minute on all of the tools and the discoveries and the components that we have in place now, the tools and systems to support our work. So just really briefly, we have all learned the most important rule of this time, which is to remain home when experiencing symptoms. We have vaccinations and boosters now available, vaccinations for all ages 6 months and older. We have revamped and enhanced the ventilation across all of our 31 campuses with enhanced ventilation to support with COVID. We have developed additional outdoor settings at almost every school where our school teams are using indoor and outdoor. We have a lot of progress on at-home testing. Our team will be sharing more about that. And we've really developed a system. Jenna and Keely lead a COVID response team in the district. We have a really well-developed system. So the reason that we're coming together tonight is just to really share what are the changes and updates in our COVID guidance. What you will see this year is that we are strongly recommending the wearing of a well-fitted mask in alignment with the CDC guidance when we are in high in Washtenaw County. But we are also prepared for the changes in circumstances that may occur at our schools. So we will be very responsive and very adaptive as we move through this year, really monitoring whenever there is a concern around a cluster, an outbreak, even just an uptick in cases, and also the other side of our concern around operations and having a full staff, because our number one goal is to have our students, our staff, our parents and community welcome in our schools. So we so appreciate you joining us this evening. I'm going to turn this over to the experts who will walk us through the Ann Arbor Public Schools Fall 22 COVID guidance. But I just want to share with you this evening, the welcome mat is out. We are so delighted to welcome our students, our parents and families into our schools. We're excited to have our district fully operational and fully open, and at the same time balancing that health and safety for our students and staff so that we can keep our students learning in school. So I'm going to hand it over to Ms. Jenna Bacalor, who serves as the Executive Director of Community and Health, fits into that part of our house. Ms. Bacalor.
Thank you so much. This is our COVID and health guidance for fall 2022. So we started off with our superintendent's welcome and emphasizing again that we will be fully open, that parents and guardians and the community are welcome in our schools. And our goal is to keep students learning in school and to have a really fantastic school year. All right, so let's look at our agenda for this presentation. So we're going to move into a little bit of a bigger picture on preventing communicable disease in schools from our lead nurse, Keely Hoffman, who also happens to be the Michigan School Nurse of the Year. Yay, Keely. Then I'll talk with you about daily operations and CDC community levels. That includes how do we manage students who become sick at school? How do we manage cases? How do we manage exposures? And then Keely will take over again and talk about the 5 key actions all of us can take to try to be safe this year. And we'll have Q&A at the end. And I do want to note that there are a lot of links embedded in the presentation, and this presentation will be posted and those links will be live. All right, so let's get started with that bigger picture overview from Nurse Keely.
Okay, thank you, Jenna. Yes, as Jenna mentioned, we kind of wanted to just point out the overall larger picture of preventing communicable diseases in our schools, beyond COVID. We've had to focus on COVID for so long that we kind of want to regroup and remind folks that, we look forward to a healthy and happy school year. And we really want to remind families to get their students updated on all their pediatric vaccines. And I know because of COVID, there is some data that shows that there is some lag behind on our required immunization. So we definitely want to emphasize that. As always, keep your child home from school when they are sick. And if you have questions, reference the AAPS school illness policy. This is just our general school illness policy that has been in effect for some time. And as always, we will welcome good hand hygiene, good hand washing, and covering our sneezes when we're in our school buildings to keep everyone safe. And you might wonder why there's this graphic of Australia. And the reason for that is that the Southern Hemisphere has been noted to have an unusually hard influenza season this past year. And I believe Australia's flu season did start early, and it impacted students in ages of, or children in ages of 5 to 9, 0 to 5, and 10 to 19 were hit the hardest. And they did note that it's been their hardest hit, their worst flu season in the past 5 years. So this is indication that public health agencies in the U.S. are on alert and, keeping an eye to see if we will here in the U.S. have a more early and aggressive flu season as well. So a good reminder to consider getting your flu shots for your children as well. And stay tuned for possible on-site flu clinic here in Ann Arbor Public Schools for students.
All right. Thank you, Keely, for that overview. It's good reminders for everybody. So I know a lot of people are probably watching tonight wanting to know how daily school operations will work this year as we try to balance preventing COVID and other communicable diseases with staying in school. So an overview of that is that our approach is to be responsive to student and school needs, to be focused on the high-risk situations in our schools and adaptable as guidance and circumstances change. And we continue our strong partnership with the Washtenaw County Health Department through all of this. So you'll notice that we're referencing them several times in the presentation. All right, next slide. So as Dr. Swift mentioned, our daily operations are many of the same things that we've been doing for the past year or longer. That enhanced ventilation, which has proven to be very important for decreasing disease transmission in classrooms and other school spaces. Keely and I have updated the daily symptom checker, and we really encourage people to, you can print it, put it on your fridge, you can use it as a good reminder, and to stay home when sick. And we'll talk a lot more about that a little bit later in the presentation. We are promoting a mask-friendly environment across all of our schools at whatever level that we're in, because we have seen that masks can be an important part of protection, not just against COVID, but even having other symptoms that are respiratory in nature. We will keep supplying our schools with masks, hand sanitizer, and home tests, and we will continue to monitor cases and respond to potential clusters. And we've done this monitoring and responding for many months now, and have really tried to perfect our systems for that. And to prevent other illnesses that might be appearing in our schools, hand hygiene and respiratory etiquette, and routine cleaning and disinfection as necessary. These are just daily operations. So let's move on and talk about what happens if a student becomes symptomatic at school. And so we also have to think about what happened before COVID. A student would start feeling sick at school, would get a sore throat, maybe a bad headache, would start coughing, and would be sent down, in elementary in particular, be sent down, or in middle or high school would walk down to the office or the nurse clinic to be sort of waiting for parent pickup. And the nurse may be able to ask about symptoms a little bit. So according to OSHA, the school clinic is a healthcare environment where masks are required. So if the student is not wearing a mask when they go down and they enter the clinic, they will be given a mask to wear. Just as we did last year, if the nurse is there and feels like it's necessary and can get permission from the parent, the nurse may be able to test a student for COVID at school. Or the nurse or the office professional may provide a home test to the parent. And we did this all spring when we were able to receive large shipments of home tests. We also strongly recommend testing before returning to school and or going to the doctor and getting a different diagnosis. We emphasize now, as we did before the pandemic and during, as we continue in the pandemic, to keep the student home until they're feeling better. And if they have some of those lingering symptoms, have them wear a mask that helps protect others, whether they had a cold or other respiratory illness. So we've been managing individual cases for a couple of years as well. And this is really a focus area for our protocols, because we know that when a person who has tested positive returns to activity, that can be a high-risk time for transmitting COVID to others. So Keely is going to get into a lot more detail about this later in the presentation, but I'll refer you to slides 20 and 21 for specific guidance. One thing that I think I really want to note to parents and guardians watching tonight is that there will no longer be notification regarding individual cases in a classroom or a building. But I will talk a little bit more about when notification will happen in the next slide. All right, as has been mentioned a couple times already, the COVID response team monitors those cases, and we really do it every day. We are looking at cases coming in, and we are monitoring. What we're doing is looking for classrooms or student groups where there are 2 or more cases to be ready to do a response of some kind, whatever is needed. We have a lot of experience monitoring and following up. So the guidance from the Washtenaw County Health Department talks about the percentage of students impacted in a group. So at a 10% within the group, who have tested positive within 7 days, we're going to notify parents of the students in that group. We're going to strongly encourage masking, and we'll probably send some tests home. And keeping in mind, in an elementary classroom, this could be 2 students. And, as happened last year, lots of times, there were 2 or 3 students, but they all had separate ways that they had contracted COVID. They had a parent at home, or they had some other exposure. When we get to 20% of the group, which could just be 1 or 2 more students, that's when we engage with the health department. This is when we begin requiring masking, and we continue testing. And when we reach 30%, that's when we would consider having a brief transition to remote at that point, and continued testing as well to see if there are any additional cases. So this is a pretty methodical approach, and we keep counts of how many students are in classrooms so we can respond quickly. So let's move on now and talk a little bit about these COVID community levels. So the community level is a category that is based on a measurement of the number of cases and the hospitalization data by county. And the CDC updates these levels every Thursday. They used to say by 8 p.m., but now last week it was actually later than 8. So we're saying by the late evening on Thursdays. So we'll be sending out a message every Friday for the following week, just mentioning what the level is. And anybody can go and check at any time to see what the Washtenaw County level is, or your home county, whatever that may be. So along with the levels themselves, the CDC offers guidance for individual people for what to do during those levels. And you'll see that there's some consistency across all 3 levels, with staying up to date with vaccinations and testing when symptomatic. And at the medium level, the CDC recommends that if you're at high risk for severe illness, to talk to your healthcare provider about masking. And at the high community level, they're recommending wearing a mask indoors, in public. And everything else just sort of builds as that level gets higher. So what you will see regarding the levels and masking is, across the board, we are encouraging a mask-friendly environment. So at the low level, where the CDC doesn't really talk about masking, we're saying that they're welcome. And you will see these signs posted at school entrances at every building. At the medium level, where masks are encouraged, and at the high or red level, they are strongly recommended. All right, so summary of our AAPS COVID response. What we know is, from experience too, is that clusters and outbreaks and impacts on school operations can happen at any of the CDC levels. Our focus, as I mentioned before, is to be responsive, adaptable, and focusing on those high-risk situations. And we will continue to use the systems that worked well for us and helped us to respond quickly last year, and either send tests home or test at school. So now I will turn it over to Keely to talk about what we all can do to avoid getting sick and protect others.
Okay, great. Thank you, Jenna. So here are the 5 actions we can take to do our part to protect ourselves and those around us from COVID. No matter which level of community spread we are in, all of these steps could be applicable. So we want to definitely encourage all to be up to date with their vaccines and boosters. Stay home if you have symptoms or are sick. And again, using our screener will be important here. Know when it is important to mask indoors and know the different situations that require that. Be ready with a small supply of home tests at home, which will be good to have, and be also prepared to consent to test your child at school, should the school nurse reach out to you. And we'll go on. And step 5, then know what to do if you test positive. or have an exposure. And I'll highlight all these in the next upcoming slides. All right, so it's important to stay up to date on your vaccines. So we are now saying up to date with your COVID vaccines instead of fully vaccinated. So it is important that our Washtenaw County Health Department recommends COVID vaccinations now for all ages, 6 months and over, and boosters for everyone age 5 and over. So we are encouraging that as well. And if you're over 50, then you are also eligible for the second booster. And as noted here on this slide, there is a new booster perhaps coming out, but that is information that is still yet to be determined. So I guess we'll wait and see what pops up in the days to come on that. All right, staying home when sick. It is important for students and staff, definitely, who feel sick to stay home. We want you to stay home and away from others as much as possible. For COVID-19 cases, we want you would be excluded from school for 5 days after symptom onset. This is if you did have a positive case, and until symptoms have improved and the individual is free for at least 24 hours from fever without fever-reducing medications. Mask use is strongly encouraged on days 6 through 10, and consider masking if you return to school, even if you have a lingering upper respiratory infection, perhaps, and you want to protect those around you, will be important. And using that daily symptom screener, which has been updated, will be important to take a look at before you send your child to school. Okay, know when to mask indoors. So AAPS is definitely mask friendly, and it is recommended that a well-fitting mask, such as a multi-layer surgical N95 or KN95, is really best. And as we know, CDC and the Washtenaw County Health Department are no longer requiring masking in indoor public spaces. Well, in the CDC red high level, but we're using this language to strongly recommend masking when we're in the high or red community levels. And we know that many students, families, and staff are not wearing masks in other indoor spaces, and it is less impactful than for schools to require masking indoors if it's not happening at all community levels. But we're being strategic about when to require masks, and we're really focusing, as Jenna mentioned earlier, on our high-risk situations, such as outbreaks in the classroom, groups, and other individuals after they return from testing positive. So masks are strongly recommended. There is a household or personal exposure when Washtenaw County is in the high level or red for community exposure, when 10% of a class or group has been tested positive. This would be moving toward an outbreak situation. And then anyone with lingering respiratory symptoms would be strongly encouraged to also wear a mask if returning to school. And then masks in AAPS are required for students and staff returning following isolation for the 6 to 10 days following their isolation period after a positive case, during a classroom or other group outbreak, in the school nurse clinic or other clinic spaces in our school buildings as required by OSHA regulation, and in our preschool classrooms at this time, also due to federal requirements. And that will be updated as guidance is also updated with the federal guidance. All right, so be ready to test at home in school. And we want you to be prepared and have a small supply of tests at home that will be available for testing. And we may ask that you test your student during times of outbreaks and classroom clusters or group clusters. And some testing may, as we mentioned, be available at school within your buildings. And so the nurse or someone from your school building may be calling, asking for consent to test your child at school, much like we did in the spring. Okay, know what to do if you test positive for COVID. So we are really putting a lot of emphasis on this process, as this is one of the critical points that Jenna also mentioned as to when someone can infect others. So we're putting a few extra precautions in place here if there is a positive case. And one that we're emphasizing is testing on day 5 following isolation and prior to returning to school is strongly encouraged. So after you've completed your 5 days of isolation, test on day 5. And then if negative, you're clear to return to school. And then masks are required when you come back to school on days 6 through 10 when returning from isolation. And it is here that we're focused again on these high-risk situations, such as multiple cases in the classroom or positive students returning from isolation. All right, so ending isolation. So as I mentioned, you'll be in isolation with a positive case for 5 days, and you can end isolation on day 5 or after 5 days and return to school on day 6 if you have had no fever for 24 hours without fever-reducing medicine, and your symptoms are greatly improved or gone. And at this time, it would be our expectation that the individual returning to school will wear a mask on days 6 through 10. And again, as mentioned earlier, the multi-layer surgical KN95 or N95 is best. And I did want to mention that if you have, so if you test positive on day 5, then we would ask that you continue to stay home until receiving a negative test or 10 days have passed. So again, that is strongly encouraged, the testing on day 5. And another note is that for some individuals who may have experienced moderate illness or severe illness, such as you had a lot of shortness of breath with your illness, or you were even hospitalized, perhaps, you may need to be in isolation at that point for 10 days. And I would strongly encourage you to discuss this with your healthcare provider as to when is the best time for you to end your isolation period. And what to do if you were exposed to COVID-19. So at this point in time, we would say to watch closely for symptoms for 10 days. We would recommend that you wear a well-fitting mask when around others, especially indoors for 10 days after that last exposure. And the recommendation would be to test on day 5 after your last exposure. If you test negative, you may consider testing again in 48 hours. So that is another consideration. And then, as always, use caution when around those around you who may be immunosuppressed or more susceptible to illness. All right. And this is just a reminder that, again, these plans may be revised as guidance and local conditions change. And we just look forward to a happy and successful school year. So thank you.
All righty. We have a lot of good questions already in. We've got a couple that kind of come together, so I'm just going to rephrase this. But for students that have suppressed immune systems or underlying medical conditions, what are some of the extra steps that they can take beyond the steps that apply for all students so that we can best protect the students that are most at risk at school?
I mean, I can take that question, Jenna. Definitely, if you have a student who is immunocompromised due to perhaps an organ transplant or chemotherapy, or a child who has an underlying health condition such as diabetes or asthma, we would definitely encourage you to have a conversation with your healthcare provider or pediatrician. And please reach out to your school nurse really before school starts if you have concerns, and they can definitely be a great support to you along this journey. And as Andrew mentioned, I believe in the question that there are already a lot of steps put in place to protect all of us, but reach out to your healthcare provider and school nurse for additional support.
Okay. Next question. My student is a high school athlete. If they get COVID, what do they have to do to get clearance to get back for practice and games and whatnot?
I can take this one. We need to have like a little signal so we know who's taking. So the guidance now is that student athletes who have a moderate or severe case of COVID, and this means things like more than 4 days of high fever or continuing muscle aches and pains, they should see their healthcare provider for medical clearance before returning to practice and games. It's just an extra check to make sure that that they're safe to continue playing.
Okay, thank you. Next question. I thought if we had a high level of COVID or we're in the red range in our county, masks would be required. Why did that change?
Mm-hmm.
Thank you. Andrew, I'll start that one and then the experts can wrap it up, of course. And I really appreciate that question. Our guidance in the Ann Arbor Public Schools mirrors the guidance of the CDC, MDHHS, and Washtenaw County Health Department, which is masks are strongly recommended. We did not tie required masking to the level, quite frankly, I want to be clear, because many times we may have challenges or concerns that emerge in schools that are not at all related to the county level at CDC. So we may have situations in a classroom, a grade level, or a school. We may have an uptick in cases at a particular school, say around a homecoming event or whatever. And so we will use that required masking as one of our layering in strategies that we will use whenever there are concerns. Those concerns may be about a rising number of cases, but they may also, I want to be clear, they may also include operational challenges in the district. And for us, that is, are we able to safely staff our schools in order to achieve that one goal we all have, which is to keep our schools open and fully operational? So there are several reasons why our required masking step is not tightly tied to the levels, but we are following the guidance with the levels. And I will tell you, I was out in schools today and saw many individuals on our teams, a high percentage choosing to mask. I believe that's what Ann Arbor will do when we are at high, because we all know how important that layer of mitigation, that strategy of masking is. So Andrew, Jenna, and Keely, what would you add there?
I would just add that we've been really strategic about when to require masking, and we have tied it to high risk situations that are actually happening in our schools. Yes. So the county levels apply to the entire county. We are being very strategic and looking at what's happening in our schools to quickly respond with additional prevention strategies, not just masking, but also testing. And this is something we've had a lot of practice in, and we assume we will do more of this year.
I just want to reassure the community, on many days last year, we were receiving case updates by the hour. We are monitoring this very closely. So typically we can see an uptick emerge well ahead of the change in county levels. So we just want to be much more responsive and adaptive based on what we're seeing emerge in our schools.
Okay, next question. Last year they had this incident happen. They're trying to figure out what will happen for this year, but a member of my household has tested positive for COVID. The student has symptoms, but is testing negatives. Should that child go to school at that point?
So if you have household positive cases and your student is testing negative, but has symptoms, then your child should stay home. So your child likely has a probable case. So that is what we would recommend. And then we would recommend testing again in 48 hours. And then if you get a negative, perhaps another 48 hours. And that is also guidance from the Washtenaw County Health Department, is that serial testing within, maybe 3 times even over the course of 5 days.
Okay, next question. How will class outbreaks be determined at the high school level? Obviously, elementary school, it's a pretty easy way to do that, but at the high school level, what's going to get done to know when we have an outbreak?
Sure, I can handle that one. So this occurred last year when we had some outbreaks in student groups. They were extracurricular groups. We didn't ever see, knock on wood, we didn't see outbreaks across classrooms at different times of day or things like that. It was in athletic teams or things like the theater guild. And so that's when we were looking at percentages. We sent tests home. We offered testing at school as well at that time. So for a high school student, it's more of the group that they're in that is more likely to have exposures that include outside of school exposures.
So, for example, Ms. Bacalor and Nurse Keeley, I remember around homecoming or Halloween or fall events, those outbreaks might be tied to the social group at a high school level more than necessarily to the classroom group. Is that what you're referencing?
Correct. Yes.
Sometimes to a sleepover or other kind of event. Yes.
Yep. We had a lot of sleepover related outbreaks last year at all grade levels.
Okay, next question. If we reach 10 or 20% sick in a classroom, can we keep our child home for a couple of days? And if we're keeping our kid home, is there any opportunity for hybrid learning at this time? And I'll tie in, there's another one that if my child does have COVID and can't, has to isolate, will they be able to attend classes online if they feel well enough?
I'll start that one. Thank you for that great question. A parent always has that right and I think responsibility to excuse their child. In each school has their structure set up, whether that's an email or a phone call, so that the school knows that you've excused the child for the day. So we absolutely encourage parents. Parents are absolutely the decision makers on that, always with our school situations. We don't at this time have the quarantine learning or hybrid learning program scaled up because of the fact that close contacts are no longer required to be quarantined. So I will say, though, that if we see a pattern emerging where large numbers of students are out of school, we absolutely can scale back up that hybrid connection, that quarantine kind of learning connection. We can do that fairly quickly. As Jenna noted on some other things, we have a lot of experience on these matters, so I do hear that concern.
Next question. What are the requirements for masking on buses?
There aren't any anymore.
Well,
I'm not sure about preschool, though.
There aren't any from the federal government, but we are following our leveled guidance that is true for the district, correct?
Yeah. So masking would be required in the situations that we've talked about. Someone returning from isolation, the school bus is an extension of the classroom in those cases. Do you happen to know, Keely, about preschool busing, if masks are required at that time?
We will check on that, but
I'll have
I
to check
believe
on
at
that.
this
Yeah.
time, I believe they still are at this time.
Mhm.
But we'll clarify that with our preschool parents. I want to emphasize that the green, yellow, red, the tiered system would apply on buses in the same way that it applies in our classroom. I also do want to point out that that will be an area that we're monitoring closely. And if we are seeing cases tick up, particularly among bus drivers, bus aides, bus riding students, that would be a layer of mitigation that we would put back in place. But at this time, there is no federal requirement for that other than potentially the one at preschool.
Okay, next question. Can we sign something at the beginning of the year that gives the nurses permission to test our child as needed with notification rather than them trying to reach us for permission in the middle of a workday?
Boy, do we want to do that. We really do want to do that. We've talked about that a lot, and have thought about it a lot. It's a lot of data to collect, and a lot of parents will never see the email, but I see that this parent would. So maybe that's a little hopeful. We're still pondering whether or not it's worth it to do, because we know that so many parents will just never even see or open the email. That would,
but it might be just thinking out loud, but it might be something like the photo permission that when we enroll in InfoSnap, there's just that question there. And so I do love the thinking, and
I do too. Because it is, I know, for working parents, you're doing something, you can't necessarily receive a call in the middle of the day and give permission. So totally taking that question to heart.
Okay, next question. Is there a scenario where a classroom or even a school might transition to virtual?
I will take the operational side of it first, and then I'll leave the health side to our health experts. There is the possibility that if, as occurred last year on a few occasions, if we are unable to have the appropriate level of staff to safely operate the school, there is a scenario where we would need to move to virtual or even to suspend for a period of time. We certainly are working very hard to keep everyone healthy and hope that we don't have those situations occur. But we cannot open our schools if we're not able to safely staff them. We've been working all summer to scale up our substitute teaching force. We do have a large number of substitute teachers committed to our district. We are paying rates above those of surrounding districts. Please don't tell them, because they'll raise their rates and then there will be. But we are doing everything we can so that scenario, Andrew, does not happen. And we hope that would be a very last resort in the process. So I've talked about the operational side, which I always have to think about. And you guys, could you add on the health side when a classroom or a school might need to transition?
Sure. And I did talk about this a little bit for slide 9. If we are really facing a situation where, a good percentage, and it's usually 30%, have tested positive, we really may need to look at transitioning to virtual, because the risk there are probably more cases that just haven't been detected yet in that classroom. So we are trying to manage and contain an outbreak at that point. So again, we're trying to keep kids in school, but we're also aware of the reality that sometimes there can be a wave that happens. It happened a few times last year, and we did go to virtual last year a few times in classrooms.
Okay, here's a question that has me. I'm don't have heard a lot about COVID, but have not heard this term. But are N95 and KN95 masks preferred over KF94 masks? I don't know what a KF94 mask is, but are the others preferred over them?
So all the guidance just refers to KN95 and 95. There's nothing about KNF. I can't even remember. I've heard of these masks before, but the guidance just doesn't mention them. So I can't really give you a solid answer on that question.
Okay.
And Andrew, while you're in between questions, we'll note that we continue to stock our schools with masks. So, in fact, I've been out at schools as we're preparing for launch next week, and we have good supplies of masks in the schools. So, if your child is in need of one, we have those available. So.
And I think this is probably a Dr. Swift. This one's probably aimed more towards you because it's not really about the COVID itself, but basically the gist of it is, will elementary kids still be bringing to and from school technology that it's, they led to a lot more screen time than they had prior to COVID? Is that still something that we're going to be doing this year? Or are we going to get back into more of the less devices in the classroom situation?
I really appreciate that question, and we'll be working with our teams as we open school to see how we're doing with COVID cases and to make sure we do, if there is a surge in progress, I hope that is not true, but if there is a surge going, we do want our students and families prepared for a potential transition. But it is a little bit early to know. Of course, our hope is that with many more folks being vaccinated and boosted, and with us all practicing the best guidance of wearing our masks while indoors, our hope is that we won't be facing that. But we will, you'll hear directly from your school principal, and we'll do that according to their developmental level as we move forward. Yes.
Okay, this one is just a clarification question. Are masks required on days 6 through 10 after a student tests positive for COVID?
Yes.
Yes.
Okay.
They are required. And when the parent, I just want to add, when the parent reports the case, the parent is asked to attest and affirm that their child will agree to wear the mask. The family agrees that the child will mask on days 6 through 10. If the family is unwilling or unable to attest to that, then we do revert to the 10 days away from the classroom. So I do want to clarify that we take it very seriously, the days 6 through 10 process.
Okay, and here we have a couple of questions. I know we don't have any facilities people here, so we may not be able to give the specific answers, but will the classrooms have HIPAA filters? And then how many air exchanges per hour are occurring in the classrooms? And what is the MERV rating? And I don't know that any of us in this group have the specific answers to that, but that is something I think that we can get in the FAQ if we don't have right now.
We can. And Andrew, I just, in the last couple of weeks, asked those guys, meaning our great facilities team and operations team, to update all of the work that they've done on our filters, our HEPA filters. We are on an escalated, more frequent changing of all the air filters in our systems across the district. We are also providing the air purifier components into classrooms, particularly into spaces where our studies of air changes demonstrate the need for them, and also into some high risk classrooms, such as classrooms of self-contained students who are in a self-contained program, students who are in a medically fragile program. So I have asked for that update and it will be included, and it will have links to all of the air studies that we've done over the previous 3 years to design and redesign, improve our process with the ventilation of air. We feel this is a key and critical component. And I just want to say my deep gratitude for our community supporting our 2019 bond, because it is largely that bond and sinking fund, those dollars that enabled us to take significant steps on air ventilation that many surrounding districts, I'm just sharing, we were very fortunate to be able to do that. Now, those dollars do not cover the air filters, but we have made adjustments in our general fund budget with support of our trustees to allow for those. The update, we'll share it, but I think it's 3 times a year now during our 9 months of school that we are changing all of our filters. So we are paying a lot of attention to air quality in our schools.
Okay. Next one. Given the severity of COVID having waned and the high level of community infection, are we still on high alert if someone is exhibiting any type of symptom? For example, are closures and cancellations made based off of symptoms?
We really do look in the classroom to have students in a state of wellness, to be at school and to be participating. I think everything falls along a continuum. Significant symptoms, we will be making a call to the parent because we feel like that's something that perhaps a test needs to be given. We just want to make sure that everyone in that classroom is as healthy as possible. I suffer from allergies, as do many people, so I do understand the question. We'll just have to take that one step at a time and work closely with your classroom teacher and with your principal regarding the exhibiting of symptoms and how we're responding. Health folks, if you want to add to that, I just was thinking responding from a systems level.
Yeah, we wouldn't close or go to virtual based on symptoms. It is based on students and or staff testing positive. So we do still need to be aware of symptoms like sore throat, cough, headache, loss of sense of taste and smell, because if people are infectious and haven't tested, they're spreading COVID to others potentially, or they have flu. So minus the loss of sense of taste and smell symptom. So we're trying to prevent a lot of disease transmission in schools to keep students from being sick, keep staff from being sick. But moving to virtual is based on actual cases. And it could be cases of flu. If we have 30% of students in a classroom out with flu, which has happened before pre-pandemic, we would look at moving that classroom to virtual as well.
Okay, we're almost done with the hour. I think I'm going to get one last question. It's a kind of a two-parter. First of all, can you define exposure? And second of all, how will I know if my student is a close contact to a case?
Keely, do you want to take this one?
Sure. Yes. I think there's definitely some debate right now out in the guidance about what true exposure is, I think, because of Omicron and the BA.5 variant being much more transmissible than, perhaps some of the other variants. But I think the guidance still stands that close contact, was the question exposure or close contact?
Exposure.
I kind of combined the two.
Yeah. So, the guidance still stands from the CDC. I don't believe that's updated yet, but I think there's talk about that being updated, but it's still a close contact would be defined as being less than 6 feet for 15 minutes or more around an individual. But I think, as we know, an exposure, as we look at it, I guess, in the classroom would be if there was a classroom, say, of 20% with a positive case, as we have done in last year, I think the threshold was 10% that the county used. This year, they're saying 20% would be considered an outbreak. So in that situation, likely all of the classmates in, the third grade class or young fives class would be considered close contacts in that situation.
And they would all receive communication with their prescribed next steps. So although parents won't be notified for individual cases, they would get a note from you all about that kind of situation, right?
Oh, yes, definitely. And I think this is one thing that is confusing, because I was confused as well. The idea of what a close contact is. We're no longer measuring distances in school settings. It is based on exposure, a high level exposure in the classroom, and the entire class is considered to be close contacts. So that's a nuanced shift that that I wish they had picked a different term or something, but that's a shift that has occurred.
And that would be the same, as Jenna said, across our clubs and groups and athletics as well.
So the football team or the basketball team, all of those kinds of groups. Yes. Andrew, I do want to toss in that we will be very clear with our preschool parents about the specific guidance for preschool. It is a little bit different, and we don't want to say anything inaccurate. So preschool parents, check that email, and our preschool principals will be in touch to make sure you understand what's expected coming up next week.
Okay. Well, as I said, our hour is done. We will be posting this video hopefully tomorrow, the presentation itself, and hopefully a FAQ document as well, all right on that same headline where you may have seen today the information about this Zoom event. And we thank you all for attending, and thank you guys for answering all these questions.
Thank you.
Thank you.
Thank you all. Take care. Have a good evening. We'll see you on Monday.